total shoulder replacement. Total shoulder replacement. Total complete shoulder replacement. So the surgeons that do shoulders are typically not the same guys that do knees and hips. You got a problem with your knee, you get a knee replacement. Your hip, you get a hip replacement. But when you have a shoulder issue, you have a total complete shoulder replacement. Pay attention. They say this. Well, what are they talking about? Well, you tore your rotator cuff. Sorry, you're 70 years old. You need your shoulder replaced. Okay. Well, they're not going to fix your rotator cuff when they do a shoulder replacement. That's not what the surgery is. Okay? Your shoulder, it's a ball and socket. It's just like a ball joint on a car. It's made of the bone. Bone is alive. We have bone marrow, blood vessels, and there are nerve endings in the bone. So to protect the bone, it's the blue stuff here, you have hard cartilage. This is a hard cartilage that looks just like and is just like the end of a chicken bone, the hard white stuff on the end of a chicken bone. That's what this cartilage is. And it creates a nice, smooth, slick surface so that your ball and socket can move around. Now, when you get a total shoulder replacement, you're actually treating osteoarthritis. They're not treating the tear. You have a full thickness tear of your supraspinatus rotator cuff muscle. It's flopping in the wind. It's not going to just grow back. You have to reconnect it surgically. But if they don't want to do arthroscopy to do that, because they think you're too old or you've compensated and it's not causing your pain, well, what does shoulder replacement do? Total, complete shoulder replacement. Well, they're going to saw off the ball. They're going to core out the socket. They're going to remove the nerve endings that live underneath this cartilage because bone's alive, right? We have bone marrow, blood vessels, and nerve endings. And when they saw off the end of the bone, they're removing the nerve endings that are causing your pain. Still not fixing your rotator cuff tear. That's a different surgery. So when they remove the ends of your bone, remove your joint, your pain goes away, right? They remove the source of pain. The problem is you don't have a shoulder, right? So what are you going to do? Well, you need the shoulder replacement. You need the titanium implant. They're going to saw this off and put a little implant with a ball and a socket, and there you go. There's your new shoulder. Still with a tear, but now theoretically your pain's better. That's what a total shoulder replacement is. You're not the $6 million man. You're not getting the bionics. They're not fixing your shoulder. They're just sawing off the end of your bone to stop your pain and throwing an implant in there because you don't have a joint. Why don't we just stop the pain? Let's heal the cartilage. Let's save your joint. If your ball's round and your socket's round, there's nothing mechanically wrong with your joint. Why would you saw it off, right? If it's flattened, if it's collapsed, if it's disfigured, yes, there's a role for replacement, right? Sometimes you need a crown. You can't get away with a filling or a root canal. Total shoulder replacement. Arrow Motion. Look us up. Happy to talk to you. Thank you.